Hi everyone. So today I wanted to talk about the ultrasound that I actually use in my practice at this current time. So in my practice, I've talked about how I use a portable device. I've used it for the last 2.5 years or so, and really, I just wanted to give a little overview of what that looks like for me in my practice. So again, my practice is about a 50-50 split. 50% of my patients I treat out of, some sort of affiliate gym, whether it's a CrossFit gym at the patient's country club or so on and so forth, or also just a true mobile visit where I go directly to their home and I help them, in that scenario. And what I do is whether I'm at one of those gyms or whether I'm taking it to their home, my setup is actually quite similar. It's just a matter of where I'm performing it. And that's why utilizing these portable devices is so incredibly beneficial for both settings, especially if you're in the sports and orthopedic setting where even if you have like a private office room, but maybe sometimes your patient's on the gym floor and they're doing some work, you really don't want to have them going back and forth, especially maybe another clinician's using that room, or it's really just time consuming and you have to wipe down a new table, keep it clean for, infection reasons. So I just wanted to give you an overview of the device I use and how I use it. Maybe in another video, I'll actually show it. I'll fire it up and I'll actually put it on a screen so you can see what it looks like, in real time. But now I'll just kind of show you my setup. So over here, I bought this little Apache case. This was maybe $10 from like a Home Depot or so. It wasn't something that came with the case by any means, but I did want, a sturdy hard case. I actually use this. So I've taken this device, you know, across the US in several planes before. I've never had a single issue with it, never had an issue with TSA or anybody wondering what the device was or kind of getting it through. One time I checked it, one time I carried it on. The future I'll probably carry it on just because it is so expensive. But anyway, just give you an overview. So the device itself, let me just angle this down a little bit. The device itself is actually quite small. I originally got such a big case is because I wanted to have a place to put my ultrasound gel in there. And at one point in time, I had it there, but as I started to accumulate more things that went in with this device, such as mostly of it is it's like the power cord. I have two sets of power cords. I have here's the device itself. I have spare batteries, and then here's the charging setup so I can charge it while one is charging while the other one is not. Each battery gives me about 3 hours of direct real-time use. So I have two batteries. I've never ever gone in an entire day where I haven't needed one. But then I also do have a plug outlet where I can just plug the unit directly into a plug and have it kind of corded if you're really kind of on a crunch for time and you don't have the ability to charge it. But anyway, here's the device itself. It's quite portable. I'm sure there are several clinicians who don't even keep it in a hard device like this. They just kind of throw it in, maybe a bag or so to speak. But this is the device. This is a linear probe. The device is a Sonon 300L. L for linear because it's a linear probe. This is just a little cap. Pops off, and there's the device itself, giving you your sonographic window. And then back here we just have a power button, Wi-Fi connectivity, and back here we just have the drawer to put the battery packs, so I can replace battery packs as needed. But other than that, that's kind of my setup. When I'm utilizing it with a patient, it's typically set up to an iPad. It works really well with any sort of mobile device, an iPad, a tablet, an Android phone, Apple phone. One of the reasons that I was kind of interested in this device specifically over other devices at that time were its versatility by using it with either device. This device really didn't discriminate against which camp you could belong to, whether you're the Android camp or the Team Apple camp. It didn't really discriminate, and I ever thought if I were going to give this to another clinician to use, I didn't want to have to mandate that they used a certain device or a certain piece of equipment, whereas other equipments that do exist mandate that it can only be used with iPhone or it can only be used with an Android or vice versa. So this one, at that time at least, it gave me a good practice opportunity for the biggest bang for my buck. There are certainly much cheaper devices out there that maybe don't give as good of an image quality. There are certainly significantly more expensive devices out there as well. It really just depends on what your needs are as a clinician and what your needs are as a practice and what your patient's needs will be when utilizing that device. So if you have any questions, feel free to leave me a comment in the comment box below. Thank you for watching.